Welcome to Wednesday's edition of COVID-19. As is the case midweek, in the absence of the weekend factor, Korea's daily tally has rebounded to hit above 2,000. And beyond national borders, we address America's withdrawal from Afghanistan and its repercussions amid the pandemic and more. We start now with the broader pandemic coverage with our Kwon Soa. Now, so I do start here on the local front with a surge in COVID-19 cases.
Right, Sunny. As you mentioned, Korea is back to above 2,000 cases, 2,025 to be exact, as of 12 a.m. on this first day of September. Almost 2,000 of those are domestic transmissions. And that is a hike by over 650 infections compared to yesterday. But if we compare the figure to last Wednesday, we are actually seeing an on-week decline by almost 130 cases. And that has brought Korea's total to 253,445, and the death toll stands at 2,292. Now, recently, the proportion of cases in the metropolitan region has been on the rise again, standing at above 70% for the second straight day. And especially the capital, Seoul, has been seeing a surge this Wednesday. 665 infections. That's the second highest rate for the daily caseload here in the capital, Seoul. And also with that, Seoul has surpassed 80,000 cases in total. The administrative city of Sejong has also hit a milestone with now reaching over 1,000 cases in total. Now, while we are still waiting for prevention measures to be abided by during the autumn harvest holiday, or Chuseok, that's coming up this month, some preparations are being made. As the government said, it will expand inspections at traditional markets from 4 to 6 times a week and also encourage online shopping. Online versions of traditional rites will also be available.
Right, I see. Meanwhile, so I hear we have a shipment of vaccines arriving from Romania as part of a deal with the country here.
That's correct, Sunny. So the government has made an announcement this Wednesday on its pandemic cooperation with Romania, under which over 1.5 million doses of vaccines, either purchased from Romania or exchanged with medical supplies, are to be shipped within the span of a week. Here are the details.
먼저 9월 2일에는
526,500 Pfizer doses are expected to arrive on September 2nd, followed by another 526,500 Pfizer doses and 450,000 Moderna doses on September 8th. The Pfizer vaccines we are receiving are manufactured in Belgium and Moderna's vaccines in Spain.
The expiration date of the Pfizer doses is September 30th, and the Moderna doses expire on various dates in November until early December. According to the Seoul government, Korea and Romania have lately been working to strengthen bilateral cooperation in the health sector. As part of that, Korea had provided Romania with COVID-19 test kits last year. Meanwhile, the vaccines coming in from Romania are expected to help accelerate the ongoing inoculation of regular citizens aged 18 to 49 that continues until early October. And also, those in that age group who have not made their reservations yet can do so until the 18th of this month. And if they want to get vaccinated before the Chuseok holiday, they should make that booking until Thursday. Now, so far, Korea has inoculated 57% of its nation's population with at least one dose, and 30.7% are fully vaccinated. Now on to our global updates. With almost 640,000 new infections reported in the past day as of noon Korea time, the total stands at 218.5 million, with 4.5 million people having died from the coronavirus so far. For a look at some countries here specifically affected, the U.S. has hit a milestone of 40 million cases in total, and the total number of deaths now standing at over 657,000. And also a concern is that hospitals there are overwhelmed, with 5 states having less than 10% of ICU hospital beds left. Also, Israel here is dealing with record high figures despite its vaccination drive as well as its booster shot drive. 10,947 is the latest caseload, which is a record high for a daily caseload. And last but not least, Vietnam is also seeing resurgence surging figures, ranking now 56th when it comes to the total caseload. It ranked 66th just a week ago, and especially concerns over a 4-day holiday there as well. And those are the updates I have for now. I will see you back on Thursday. Sunny?
All right, so thank you very much for those updates.
My pleasure.
Right, staying on the international front, resurgences across the globe appear to be re-affecting movement across borders. For more on this reality, I have our G. Abby Lee here in the studio with me. G, welcome back.
Hi, Sunny. So during the summer, travel restrictions are eased in some parts of the world, given the rise in vaccination figures. But due to the fast-spreading Delta and Lambda variant, even countries with high vaccination rates are seeing a rebound in the infection rates. During Tuesday's briefing, the KDCA also announced stricter rules of its own.
최근 람다 변이 관련한
Due to growing concerns over the Lambda variant, we have strengthened our entry protocols for travelers from Peru and Chile. Starting September 10th, they will subject to 7-day isolation at a designated facility, after which they can transition to self-quarantine if they test negative.
This applies to Korean citizens and long-term foreign residents who will receive PCR tests on the first and sixth day of their arrival. The protocol for short-term visitors to the country remain unchanged, meaning they need to quarantine for 14 days upon arrival.
Right, G, what about Koreans seeking to travel overseas then?
That's also become harder. With cases on the rise in Korea, more restrictions have been added to travel's bubble between Korea and Saipan. Earlier this month, Saipan strengthened its early protocols for travelers from Korea, only allowing them to stay in one area called the Kensington Hotel for 5 days upon arrival in August. Many industry experts expect the local government to extend this measure through September. About 10 days ago, Guam also tightened its restrictions, limiting the access to indoor and outdoor public venues to fully vaccinated locals and visitors alike.
I see. Meanwhile, G, I hear travel restrictions have been proposed on American travelers by the EU as well.
That's right. So earlier this week, the European member states agreed to remove the United States from its safe travel list. That means travelers from those countries will likely face tighter controls when visiting an EU member country. What the list aims to do is to unify travel measures across the bloc, but member nations are not legally bound to follow the recommendations. Some EU members, namely Germany and Belgium, have categorized the U.S. as red, which means U.S. travelers are subject to PCR tests and quarantine. On the contrary, France and the Netherlands have classified the U.S. as safe.
I see. So there is a discrepancy there. Well, why the tough stance by the EU right now?
Well, the situation is quite dire in much of the European Union, with a whopping 11% on-week rise in the number of deaths in the region. So far, Europe has recorded around 1.3 million deaths from COVID-19 since the pandemic began. The World Health Organization explained there were 3 worrying factors: high transmission rates, slowing vaccinations, and the easing of restrictions. At the start of the summer, when the EU opened up travel to U.S. visitors, the average rate of daily COVID cases in the U.S. was at about 40 per million people. Now, that number has risen to more than 450 per million people in the last week of August. Other countries also removed from the safe travel list are Israel, Kosovo, Lebanon, Montenegro, and North Macedonia.
Which means that's a total of 6 countries, as you mentioned earlier. Now, what is it like the other way around, meaning for European travelers to the US?
It's actually even harsher. So since the pandemic began, the US hasn't allowed European visitors to visit the US freely. That led to a divide within the bloc, with one side concerned about the lack of reciprocity and the rising number of US cases, and the other side more hesitant to restrict US travelers due to their reliance on tourism revenues. Even though 70% of adults in the EU are now fully vaccinated, the rate of inoculation is on a slowing trend. Vaccination coverage is also lower in poorer European countries, with some only having managed to vaccinate around 10% of its healthcare workers, never mind the general population. That's all for me today. I'll be back same time next week.
All right, Jay, as always, thank you very much for the coverage.
Thanks for having me.
Right, elsewhere, America's military campaign in Afghanistan has come to an end following almost 2 decades of conflict Over 123,000 people were airlifted from Kabul in a massive yet chaotic evacuation operation over a fortnight. Now, for more, I have Christian Daytalk live on the line. Christian, welcome.
Thanks so much for having me, Sunheed.
Right, Christian, let's begin with President Biden's public address on Tuesday local time regarding that decision to end the war in Afghanistan.
Certainly. Well, we heard the president speak, and this was a rather monumental remarks. It was a televised address that the president delivered from the state dining room, one of the more stately rooms at the White House. And he made his case once again for why the United States needed to end this war, needed to withdraw all troops, and make sure that we evacuated both Americans, Afghan nationals who are at risk of being targeted by the Taliban, and allied nation citizens who are living in the country when Kabul collapsed. That being said, the president is facing harsh criticism from both Republicans and Democrats here in the United States for how they rolled out that withdrawal and handled the subsequent evacuation over the past week and a half.
Right, Christian, now, like you mentioned, all military personnel have been pulled out, but humanitarian evacuations involving between 100 and 200 Americans and thousands of U.S.-aligned Afghan nationals have yet to be carried out. I suppose the question now is, will the Taliban commit to such humanitarian operations as announced by Mr. Biden, Christian?
Well, that was a question that White House Press Secretary Jen Psaki had to address in today's press briefing. And she said, look, we have many tools. We have lots of leverage to which we can hold the Taliban to these commitments, primarily access to the global financial markets. Now, the United States, World Bank, and a number of other countries moved to freeze government accounts so that Taliban officials did not have access to roughly $15 billion in government reserves. And if the Taliban, like they have said over the past week and a half or so, want to be recognized as a legitimate government by the international community, they're going to have to make sure that these Americans, and again, citizens of our allies, both here in the Western Hemisphere and across the world, can get out of the country safely. Now, those 100 to 200 Americans who are still on the ground in Kabul, there are a number of them who don't want to come back to the States. They might be dual citizens, permanent residents of Afghanistan, who've lived there for quite some time. Yet President Biden, during that address, outlined that there is no deadline to which the United States will help people return to the States if they so choose.
Right. Christian, there also appears to be some concern over the billions of dollars worth of U.S. military equipment left behind in Afghanistan. Could you tell us a bit about this?
Well, Sunny, one of the largest problems is we don't exactly know how much equipment is left for the Taliban to take over. Now, the United States, as part of this retrograde withdrawal, destroyed a lot of that. There was a certain amount of the Afghan Security Forces Air Force, which was already inoperable. Their Chinook helicopter fleet that the Taliban will not be able to take advantage of. But Republicans in particular here in the United States are demanding that the president reclaim all of the equipment that was left in Afghanistan. And that's just unrealistic at this point in time, given the fact that we no longer have a diplomatic presence in that country.
Right. Meanwhile, Christian, what is the plan for Afghan nationals seeking refuge over in the U.S., as well as those who are still searching for safe passage into the U.S.?
Well, that's going to be a slow process. And the first flights of Afghan nationals landed here in Washington, D.C. late last week. They're being spread out across the country. And there is some resistance from local communities across the nation to accept this large influx of refugees. That being said, the majority of the country are welcoming of these people as a whole, but the president still has to face a lot of roadblocks. And unfortunately, at this point in the game, a lot of that just has to do with local politics and the politics of the 2020 midterm elections that are coming up. That being said, the president, the White House, they're holding daily briefings with governors and local government officials on how they can resettle these people, how we can sort of mainstream them into American society and try and make what was clearly a very traumatic past week and a half or so just a little bit less traumatic.
Right. And talking about politics, Christian, what are the ripple effects of this exit strategy from Afghanistan on the Biden administration, do you think?
Well, it's certainly going to have an impact on the 22 midterm elections, like I mentioned. There is a serious chance that Democrats lose both control of the House of Representatives and the Senate. That being said, Americans traditionally don't vote on foreign policy. Hopefully this doesn't get to this point in time, but if there was some type of terror attack, whether it was against U.S. targets or an allied nation that could be traced back to operators in Afghanistan, that's going to have a dire effect for both the Democrats' chances in the 2022 midterms and President Joe Biden's possible re-election campaign coming up in 2024.
Right. And Christian, before you go, do tell us a bit about the measures in place to address COVID-19 in the US, especially in light of the European Union's calls for travel restrictions on American visitors, as mentioned by my colleague G earlier on.
Well, as G mentioned in that previous segment, the rise of the Lambda and the Delta variants are what's sort of kickstarting this third or even fourth wave, if you will. That being said, there is good news for Americans on the horizon. The FDA and the CDC just recently approved third coronavirus booster vaccine doses for people to take as soon as 8 months after they've received their first round of shots. Now, the president and his top medical advisor, Dr. Anthony Fauci, have considered actually dropping that wait from 8 months to even 6 or 5 months. So there is a chance that Americans will be getting that third dose even sooner than anticipated.
All right, Christian, thank you very much for making the time to shed light on the events over in the US for us.
Anytime. Great to be with you.
Right, shifting gears now, in yet another story of perseverance amid the pandemic, we bring you the challenges faced by pregnant women here to ensure the safety of their babies and their own. Do take a look.
정다은 is a woman in her 30s and an expecting mother who's around 7 months pregnant. Now in her final trimester, she finds it difficult to even walk short distances, especially while wearing a face mask.
아무래도 임신하고 나서 몸 상태가 조금 더 바뀌었기 때문에 뭐 숨이 빨리 찬다든지 이런 게 있었는데 마스크 때문에 더 힘들고 기존 체력과는 확실히 달라져서 너무너무 힘든 것 같아요.
And this is not the only challenge being faced by Jung and her husband. Normally, her husband would have come with her to the hospital for her regular checkup. But pregnant women like Jung are only allowed to visit the doctor alone due to COVID-19 restrictions.
심장 소리 같은 것도 다 이런 동영상으로만 보니까 아직 29주차인데도 좀 실감이 안 나는 것 같고.
This is a restaurant in central Seoul that is run by the couple. Due to the current restrictions on business hours, the couple had to send all of their workers home, and Jung is now waiting the tables here all by herself.
그래도 갈수록 많이 나오고 해가지고 이제 더 힘들어지고 있는 상태인데 이제 밖에서 마스크도 못 벗고 날씨도 더 덥고 이제 습해지기까지 하니까 그럼 볼 때마다 안쓰럽고 좀 그렇죠.
Jung doesn't mind putting in the extra work, but she is concerned about the possibility of being infected with COVID-19. Even though she's exercising every precaution in the book, Jung is still worried about catching COVID-19 and what it would mean not only for her own personal health, but also that of her unborn baby. There is also the question of postpartum care.
지금 4단계 연장으로 산후조리원 보호자 출입이 불가능한 건가요? 네, 안 되는 거죠? 알겠습니다.
Korean health authority guidelines mean that visitor access to the venues is heavily restricted. With family members unable to see the new mothers and their babies in person, they've turned to live video chat services to meet virtually.
다른 산모들 얘기를 들어보니까 진통을 할 때도 마스크를 끼고 한다고 하더라고요. 그래서 그런 게 너무 벌써부터 걱정이 되고 아기가 나왔을 때도 지금 신생아 때는 이제 집 밖에 거의 못 나갈 거라는 생각을 가지고 있기 때문에 조금 걱정이 많아요.
COVID-19 poses an elevated health risk to pregnant women and their newborns. According to Korean researchers, an expecting mother who contracts COVID-19 is more likely to give birth prematurely compared to normal, healthy women. While their babies faced more than double the risk of respiratory distress syndrome, also known as RDS.
코로나 바이러스가 지금 이제 대유행을 하고 있는 지금 상태에 임신을 계획하고 있거나 아니면 임신한 산모들은 일단 우리 백신을 맞을 수가 있는지를 제일 많이 궁금해하고 걱정을 합니다. 근데 실제로는 미국이나 유럽 같은 나라에서는 임신 상태에도 백신을 맞는 것이 본인의 건강과 태아의 건강에 유리하다고 판단을 해서 현재 시행을 하고 있습니다.
Future mothers here in Korea may be able to get their vaccine soon enough, after health authorities gave the green light to inoculations for pregnant women, which may begin sometime in September. For Chung and others like her, this should be the happiest time of their lives. But their joys of motherhood have been interrupted by the continuing onslaught of COVID-19.
Afghan evacuees who worked alongside the South Korean mission in Afghanistan
arrived at Incheon International Airport.
대한민국을 위해서 기여가 있었던 그런 조력자분들이십니다. 따라서 난민보다는 생계비라든지 또는 정착 지원금, 교육과 같은 면에서 다소 더 많은 배려가 있을 예정입니다.
Once screened and cleared, we will welcome these Afghans who helped us in the war effort over the last 20 years to their new home in the United States of America. Because that's who we are. That's what America is.
In today's studio session, we turn the spotlight onto the fate of people who have been forced to flee their homes amid the pandemic, including those from Afghanistan, as the Taliban takes the reins of the country. For more, I have Professor Kim Moon-gyu from Yonsei University. Welcome back, Professor Kim.
Thank you for having me.
I also have visiting Professor An Jun-sung also from Yonsei University. Good to see you again, Professor An.
Thank you.
Meanwhile, joining the session virtually is Dr. Aditi Hazra at Harvard Medical School. Good to have you with us, Dr. Hazra.
Thank you, Sunny. Good to be with you.
Right, Professor An, let's start here in the studio. Korea has welcomed 390 Afghan nationals under the status of persons of special merit. First, let's start with the definition of this title and how does it differ from the status of refugee?
Yes, that's correct. That's a new concept, and the person of special merit is very new. Actually, it's created by the Ministry of Justice, right? And under the immigration law, there are three types of person: is a national, which is Korean citizen, and then alien, which is a foreigner, and then the refugee, which is defined under the Refugee Act. And then the Ministry of Justice created the new concept of the person of special merit is to provide the de facto refugee status to Afghan the SQEs, right? So and then actually it's even better than refugee status because that if a refugee have to go through very lengthy and very difficult the determination process, which is very low rate of the success, right? It's about 0.4% last year. So that's the I think that could better benefit for the African rescues, and also the and then they have the F2 visa status, which is the 5-year renewable. So if they intend to stay, and then after 5 years, and there's automatic renewal, and also they're allowed to work in Korea. So it's like refugee status. It's even better, but they don't call it refugee. It's de facto refugee status.
Right. And Professor Kim, given the ongoing pandemic, how are authorities here working to ensure the safety of these Afghan evacuees from COVID-19?
Well, there were 4 among 390 persons who got positive for COVID-19 at the entrance.
surprisingly, all 4 are from different family. So that means it might be more. It might be in a subclinical status maybe. So some might turn positive in the near future, or they may be already immune against COVID-19. Since we have a report from VOA in June that they say about 60% of patients, newly developed patients in Afghanistan was having Delta variant. So that means already there was a huge outbreak, and there was a shortage of oxygen, and the medical facilities were satisfied and overwhelmed, and huge numbers of fatalities. And if you look at the data from our world, there is a huge rise in cases in July. I think that is because of the Delta variant. It was about 40 cases per million, which is a little bit higher than the data we have right now. And well, Afghan used to have always a lower number of cases compared to Korea all through the pandemic. Nobody would think that Afghanistan would have a better medical service compared to Korea, but there might be some reasons that they have a lower test and maybe manpower, and laboratory facilities is not so good as ours. So there might be this might be the explanation. Anyway, it seems lucky that we have only 4 cases, and but still we have to need full precaution because it is Delta variant. Anyway, that 390 case is a cohort, and we are well prepared to deal with their health issues, and the numbers of the people are manageable, and we can isolate them enough time in a well prepared facility. And one thing good for us is all the persons came into a very new environment, and that makes them necessary to follow our recommendations. So it's easy to control, I mean. And the final thing that I want to say is that they came from a very different cultural background and very different religious background, so we have to be cautious about that.
Right. Beyond national borders, Dr. Hazra, how is the international community responding to the plight of Afghans seeking refuge overseas?
Thank you. So the international community is assisting with evacuations. The U.S. military has evacuated about 140,000 people since July, and are processing the special immigration visa for those individuals who worked with the U.S. Armed Forces. The EU is also contributing and providing aid to the local region for Afghanistan refugees that are looking to resettle in Pakistan or neighboring countries. So the support has to be multilateral, and at this time we need solidarity with our global neighbors to ensure that they have not only access to preventive measures for COVID-19, but also food insecurity and wash and other humanitarian assistance.
Right, of course. Professor Kim, the figures are conflicting, but according to Our World in data that you mentioned earlier, about 2% of the population in Afghanistan has received 1 dose of the COVID-19 vaccine. And the inoculation rate is apparently plunging ever since the Taliban took power. Now, I understand this is a tough question because you're based here in Korea, but what are your thoughts on the COVID-19 situation in Afghanistan?
Well, I never visited Afghanistan, but so I don't know exactly how the public health system is working, especially before August. But reports from Our World shows that COVID-19 cases per million was lower than Korea, and I think there was the testing number was very low, and domestic travel and international travel must be very lower compared to Korea. So that might be another reason that they have a low count. as I mentioned, in June, the Delta variant was found, and in July, they had a sharp increase, which might be explained that Afghan and India has a very close relationship. So I think somehow the Delta variant reached the Afghanistan. The recent drop of COVID-19 cases might came from that political instability, such as the meltdown of the whole government system, and the whole reporting system also should be shut down. And the report from UNICEF says that the vaccination rate dropped to 20%. So that's a big issue. And as you can have these kind of data, I can speculate that all that 20 years of efforts to build up Afghan's public health system had achieved some goals somehow. I mean, it was better than none, and I feel very sorry that this current situation is very bad, and it's very hard to build up and easy to break down. Those who are in power are fighters. They never had a experience on governing a nation properly. They say that women's rights will be protected. It's a message that everybody welcomes, but anybody can say that. We have to see what conditions they have. They say under Sharia law. And most countries that follow Sharia law have their own interpretation. So it's not the same. And we well know that Taliban thinks, how Taliban thinks about women. It is a totally different, it is totally different from other countries like Jordan. Jordan applies Sharia law only in a family court. And the rest of the legal structure is never following Sharia law. But Taliban is a very radical group, so it's going to be very different. And I don't think there's going to be a huge change in the way they did 20 years ago. So the reason I mention about Sharia is about women. Women consist the core component of health system, like nurses. They understand about vaccine, they understand about cold chain, and they easily can approach to females from different families. You know, Islam doesn't allow anybody to visit and give vaccinations. It should be a female. So if nurses cannot do their jobs, there's going to be a huge problem maintaining the whole public care, healthcare system. So if the hardcore hasn't changed, the public health domain in Afghanistan is going to be crushed hardly.
Right. Meanwhile, Dr. Hazra, I believe Afghans arriving in the US, meanwhile, are being inoculated against COVID-19. Could you tell us a bit more about this initiative?
Sure. The Federal Emergency Management Agency has set up a mass vaccination site for evacuees, US citizens, and green card holders. The single-dose Johnson & Johnson vaccine is safe and effective and being offered at a mass vaccination site near Dulles Airport where they are arriving. And they also are being tested for COVID-19 and isolated if they are positive before they are then taken to other military bases where they will undergo a more comprehensive health screening. So the vaccine, as well as testing and isolation services, are available to refugees upon arrival.
Right, that is good to know. Professor An, do you see the fate of Afghan nationals seeking asylum overseas as perhaps evolving into an important international agenda?
Yes, well, it has become important already, right? It's a big issue, and especially the two factors, right? One of the things that there was sudden U.S. military withdrawal, right? And then there's a pandemic situation. So things got really worse, and because of the U.S. government, depends on how U.S. government handled the situation in Afghanistan, whether how they deal with the Taliban government, right? That will be a big factor, because that the other allies government would not work the other way, right? They have to work together. So international support is necessary to handle the situation, and especially I think really concerned. I looked up the map, the global map. It's very interesting fact that Afghanistan is bordering many very dynamic countries, right? Like Pakistan, which is very close tie, has close tie with Taliban historically. Also, they're bordering Iran, and then a really good friend with the U.S. Also, they're bordering China, right? So there's many international factors I think that will kick in play, and there's we have to see how things develop in international, politics, how U.S. government handle situation and how we handle with that one, and also about the international the refugee situation. Also, how the U.S. government will kind of saying that they will accept all the moral responsibility for that, but I think the international community also shares some burden on it because the reason we got the create the concept of personal special merit is that we participated the Afghan operations. So we did it, we worked together. That's why we accepted people who work us there. So I guess things got a little bit complicated compared to other refugee situation, but still there were a lot of things we have to solve it. To handle it with the international community.
Right. Well, the Moon administration here talked about having a moral obligation to our friends in Afghanistan who helped us. Now, Dr. Hazra, broadly speaking, what has been the impact of the pandemic on the world's population of refugees?
So thank you for asking that important question. So we have now over 82 million individuals that are forcibly displaced, and the refugee designation is for 26 million people that have been displaced due to climate or conflict. In addition to refugees from Syria, Afghanistan, we also have a crisis in Venezuela where millions of people are internally displaced in Venezuela, and there are 5.6 million migrants and refugees abroad. There's also an incredible amount of food insecurity in the country, suggesting additional displacement forthcoming.
Dr. Hazra, aside from pandemic-related restrictions, what other factors do you suppose are aggravating the plight of refugees in general?
Sure, that's a really great question. So the host nations that have the most refugees right now are Turkey, Colombia, Pakistan, Uganda, and Germany. And many of these countries are hosting the refugees from Syria and are at capacity. So trying to think about how we can equitably host the current migrants and incorporate additional refugees is a challenge. And countries are considering both aid to the local region as well as resettlement strategies. But certainly we do have, as you said, a moral obligation to our global neighbors and must stand in solidarity with women and children and women's rights under the Refugee Convention, as well as the Global Compact for Refugees, to ensure health and human rights to these individuals.
Of course. Meanwhile, back here in the country, Professor An, what has been the impact of pandemic restrictions on Korea's efforts to ensure access to asylum processes?
Well, as I mentioned earlier, the pandemic issue is a really new factor to do in terms of refugee determination, right? Also, we have actual cases, coming out. Also, that the how we handle this is very important. I think that the government have to get a bigger plan how to handle the situation for even the future coming. Also, the Afghan issue would not be solved within a year or two, right? There will be U.S. military state for 2 decades, right? And you have to expect that there's something other things could get worse that area. Also, the refugees, in terms of international refugee, the government have to look at the big picture. However, before we talk about the government approach, we have to talk about the Korean publics, the kind of anti-refugee sentiment. There's a strong anti-sentiment in Korea in public. So I think that the government have to do maybe some campaign or some lot of work, or is it really benefiting the Korean society as a whole, receiving more refugees, right? That's kind of things the Korean government have to do, kind of education, more promotion and education, and then is what kind of responsibility as the let's say, developed country, right? As the leading country in the future, in terms of international leadership, right? Maybe we kind of have to accept more international refugees in the future. So we have to prepare for it. Maybe working on this, regulatory frameworks and how we handle it, about the refugee, regulations, also how we work with other countries. But however, I looked it up when I put this today, and it's very interesting. In the Far East Asia, refugee acceptance rate is very low. Even Japan, China, actually in terms of Far East Asia, Korea is highest, but still extremely low. It's only 0.4% last year, and then if you see last 10 years, about the 1.5%, still very low.
Is it 1.5% for Korea?
Yeah, for last 10 years. Last 10, but last year alone 2020 is only 0.4%. So there's only 52 out of about 12,000 applicants. So it's things that we have to consider. But also, before we go to changing any law, we have to get through. There should be like a consensus, public consensus on how we deal with how you see looking at the refugees. How do we handle it? I think that the reason the government come up with the idea about person of special merit is that they do not want. I'm not really optimistic on increasing big number in the near future, because that the reason they created the person of special merit is that they're not going to accept many refugees in the short term at least. And plus there's an election coming up next year, so there's a lot of political issues. It become a sensitive issue, so nobody want to touch on it. So that's why they created a new concept, I think.
Right. Meanwhile, Professor Kim, now I hear that you previously offered medical support to refugees in Jordan. You were there for about 3 years. Now, based on your experience there, what assistance do you suppose is of utmost importance to these individuals then?
Well, for refugees, so many needs and no complete solution short term. And that is my experience. And most of the refugee camps that shows on the news are somewhat stabilized and large enough, and the helping hands can reach. That means there are even smaller ones never shown on the news, only locals know, and the situation more miserable. So at acute stage, relief organizations has to provide everything, food, tent, and security, everything. At this stage, urgent disease such as fracture, trauma, wounds from the war, as the main medical issues. And as time goes by, refugees start to find jobs, the way to survive, and they try to enter nearby communities. Because the living environment is so harsh and poor and crowded, refugees suffer many diseases, upper respiratory infections in between season, and acute gastroenteritis in summer season, skin problems in humid weather, and PTSD, post-traumatic shock syndrome, and aggravation of chronic illnesses they already have, like diabetes and hypertension, coronary heart disease, degenerative arthritis, etc. So if they are exposed to COVID-19 from locals, or opposite way, if they spread to the locals, this might end up in a big outbreak. So more infections, more possibility to have new variants. So we have to stop this, and this may be the reason that the vaccinating refugees should be prioritized over booster shots in other countries. For example, Jordan is a country for refugees. Palestinians came in at 1947 and 1967, 48 and 1967. Iraqis came in 1991 and 2003. Syrians came in 2011, and there are Lebanese, Libyanese, Sudanese, even Chechen. So Jordan government established a refugee camps before the main influx started in recent episodes. And they're showing a very good example, and they're giving vaccination equally with locals. So by the help from government and UNHCR and NGOs. So I think international community needs to pay more attention to countries with huge refugee influx, like Rohingyas, Syrians, some Africans, and Afghanistans.
Right, so greater support is needed for those countries. All right, Professor Kim, as always, thank you very much for your insights.
Thank you so much.
Professor Ann here in the studio, thank you very much for joining us
Thank
today.
you.
And Dr. Hazra over in the US, thank you very much for making time to join us with your thoughts.
Thank you.
Right, the pandemic continues to test national commitment to protecting people, and now that test has been broadened to include global commitment to protecting those displaced. Well, many are working for top marks there, and our support stands with them. Thank you for watching.